My name is Dr. Aamer Sandoo and I'm a lecturer in cardiovascular physiology here at Bangor University in the School of Sport, Health and Exercise Sciences. The population that we're currently doing our research in is chronic kidney disease patients. Now, what we want to do is understand more about some of the factors that can predict a decline in kidney function. And what we want to do is to try and understand the reasons why patients might have a large drop in their kidney function and then target interventions to try and reduce that decline. And specifically what we will be doing with this technique is looking at the structure of the blood vessel, and we hope that that will tell us a little bit more information about what's happening in the structure of the kidney blood vessels and more kind of globally within the body. The carotid artery is one of the large arteries that branches from the heart and it takes blood up towards the brain. So in terms of its anatomy, it's a fairly large vessel and it's carrying a lot of blood, and if this artery becomes abnormal in its structure and also its function, then there will be quite a lot of symptoms experienced by an individual. So what's being demonstrated is a scan of the carotid artery. So what we can actually see is that Liam has got the probe held just at the side part of the neck, and we can see two white lines contained within this green box. Now these white lines show the vascular wall. Okay, they show the three layers of the blood vessel wall, the endothelium, which is the innermost layer, and then we have which is like a faint inner line that you might just be able to see if I move my pen out of the way, faint inner line which is the endothelial cells, and then you can see the solid white line which is basically the media, which is the middle smooth muscle layer of the blood vessel, and the adventitia. And what Liam is trying to do is capture a very good image so that we can use software to do some post-processing of these images and actually look at the gap between the faint inner line and the solid white line, because if that gap has thickened, then that indicates a degree of what we call atherosclerosis, which is basically inflammation and hardening of the blood vessel. So if that gap has thickened, that tells us that this patient is at a greater risk of having heart disease or even a heart attack in the future.